The lung is a unique organ. It's exposed to the outside world. If you think about it, your heart, your liver, your spleen, they're all protected under muscles and bone. Lungs, they're out there. So what you're breathing winds up in your lungs. So the lungs have a very elaborate mechanism to clear themselves. However, when this goes awry, when there are diseases like bronchiectasis, now the lungs are a beautiful place for bacteria to grow, right? If I was a bacteria, warm, dark, damp. Perfect.
Deep breath in.
So once your natural airway clearance is compromised, we need to help you.
They've lost the ability for the cilia to move mucus and bacteria in most of these very small distal airways. So airway clearance is mechanical for them in trying to dislodge some of those mucus plugs.
And as explained to patients, when you got water in your basement, when you got increased bacteria in your basement, you got to stop the water from going in. You know, that's stop the swallow problem, stop the reflux problem and all, but you also got to get it out, and that's what the airway clearance is for.
If you can get a handle on the type of cough they have, the characteristics of the sputum, what is their problem really? You know, some patients just are profusely expectorating sputum, but others can't seem to mobilize it. So I feel like when you send a patient to an expert like yourself and your program, you get that information. You can figure out with them what the airway needs in order for the airway clearance to be effective.
What's common in people with bronchiectasis is that many of them are chronically colonized with bacteria. There's this vicious cycle we talk about where there's bacterial infection, a lot of inflammation in the lung, and hypersecretion of mucus. And that mucus collection in the lung serves as a breeding ground for bacteria. So it's so important to clear the mucus from the lungs to reduce the frequency of infections. I think first-line treatment is airway clearance.
First-line treatment, okay.
So the hallmarks of bronchiectasis are airways that become dilated, distorted, kinked, and then instead of having this nice, clear path, you have to really work your way around through a maze in order to clear that mucus. In those situations, we have to take science and use it to our advantage, and that means using different positions, that means using different devices, and that means using different techniques.
Breathing in through your nose and forceful breath out.
My first recollection of airway clearance had a very interesting start. I was a staff physical therapist at Rusk. I wound up eventually through their rotations going to basically the in-hospital unit. And we wound up bringing a therapist from Brompton Hospital in England over here to set up a pre- and post-op chest unit. So that was really my very initial exposure to thinking about working with the chest and how important it was in pre- and post-op management.
The current climate in medicine, I call it the blinder approach. You treat this. You forget that this occurs in a whole patient. It's really getting a story from the patient, understanding how their symptoms impact how they live.
The assessment of someone who complains of mucus production is a history and physical, three-dimensional imaging, and analysis of the microbiology of the sputum. All of these things have to be taken into account.
Really, bronchiectasis is a structural lung disease. It's abnormal dilatation of the airways that leads to mucus pooling, and that can lead to chronic infections, and that causes inflammation, further lung destruction, and further bronchiectasis.
The portal to all of this is the CAT scan. That's where you're going to find bronchiectasis, that's where you're going to find damaged airways, that's where you're going to find secretion retention.
And people are not as familiar with bronchiectasis as they are with COPD. So a lot of misdiagnosis of COPD or chronic bronchitis. And so people come and they haven't had imaging, they haven't had any airway clearance training, they haven't had any investigations about why they've had bronchiectasis. So people have been symptomatic for many years before they are diagnosed quite often.
Honestly, I'd like the treatment to be as simple as possible. I like the treatment burden to be as low as possible. Sometimes I show patients all of the mucoid impaction on their CAT scan, and I explain that if we do treatment modalities to help clear at least some of that mucus, that will help perhaps clear infection, reduce the inflammation, and reduce the frequency of infections.
Most of the time when they have bronchitis, I suggest them to use the saline solution. If they have the nebulizer, I teach them how to breathe properly in the nebulizer, to optimize the delivery of those chemicals
There absolutely are things that you can do to help yourself clear secretions, prevent infection, prevent exacerbation, and prevent hospitalization. Airway clearance, airway clearance, airway clearance. I cannot say enough how important airway clearance is to somebody living with a respiratory disease.
If they have cough, if they have mucus production, the first thing I'm gonna do is talk to them about the importance of airway clearance.
Deep breath in through your nose and blow it out gently through your mouth.
One goal of airway clearance is to try to prevent the need to go on these further therapies such as chronic antibiotics and prevent those side effects from occurring.
In terms of what to do, I try to see what works best with their lifestyle, because I can show them the best technique in the world, the best breath techniques, autogenic drainage, ACBTs, tell them to use the vest, but if they're not going to use it, it's not going to be effective.
Yeah, doc, I do it, but I can't really do it 5 days a week. I can't twice a day. I mean, yeah, it helps, but I just can't do it that often. So, like everything else, we got to work with the patient, what works, when it works, how it works.
I find that it's really important for me to do airway clearance twice a day, one in the morning, one at night. I first nebulize albuterol, and then I nebulize saline. After I do that, then I use the aerobica, and then finally ending it with the huff cough, typically.
Deep breath in and huff it out, fog that mirror, deep breath.
As a patient, it's important to take stock in how you feel that day. Am I coughing up a lot of mucus? Is the mucus thick or thin? What color is it? Is it white, clear, green, red, blood tinged? All these things make a difference. All these things are giving us clues.
I try to keep my antibiotics as narrow as possible, not the idea of just killing everything. And I try to get sputum samples, and sometimes we'll try to induce sputum. But once you get them as clear as you can, keeping them on a rigorous pulmonary hygiene program is the best thing you can do.
So there's not one right way to do airway clearance, and it really has to be individualized for the patient. The thing that takes us the most time is our airway clearance education and figuring out what the right regimen is for a patient. It's much easier to figure out which antibiotics they should be on than figuring out what airway clearance they need to be on.
And blow it out.
Really, a standard approach is nebulization with saline, high-frequency chest wall oscillation therapy, positive expiratory pressure device, and working with chest physiotherapists to really learn some of the manual techniques that are out there, such as autogenic drainage, active cycle breathing technique, and exercise also is very important for patients.
Systemic corticosteroids, prednisone, Solu-Medrol, inhaled steroids. On the one hand, they're anti-inflammatory. The problem is there's never a free lunch, and when you give an anti-inflammatory, you're also giving something that suppresses the immune system. The ancient Greeks knew when they were sick, they would go and recover at the ocean shore because of the salt water. So simple things like salt nebulization helps antibacteriostatic, it's a mucolytic, it loosens it.
There is not one size fits all. So for some people it may be a vest, for some people it may be an aerobica, for some people they like positional therapy.
When I was in medical school, when we used to ride our dinosaur to the hospital, postural drainage was something that was part of chest physical therapy, and it was thought to be very important. Those concepts of postural drainage seem to have been lost along the way.
It's all down here. But if you tip them, it tends to move up. So let gravity help the secretions move to where you can get at them, whether by suctioning or by expectoration, whatever you need to do.
This is you in the upright position, okay? So you can cough and cough and cough, but the mucus is not gonna come up because it's gotta get to the larger airways where the cough mechanism is effective. The more you have, the deeper it is, the more tight it gets, the drier it gets, the more sticky it gets, and the less you're able to breathe.
Okay, you can take a deep breath in. Expand the rib cage. Hold for 1 or 2 seconds, and then
So I teach them breathing exercises where they do diaphragmatic breathing about 5 times, followed by lateral costal expansion, and then followed by huffing, coughing, and expectorating at least 3 times. We do the apical sitting back, the posterior forward, and percuss over the scapula, and then flat lying anterior. So it's an open glottis, so usually oval mouth, As you take in a deep breath, huff, keep your end, huff out as long as you can. Again. And again. Huff, cough, expectorate. Huff, cough, expectorate. Huff, cough, expectorate. At least 3 times like that.
Today we're going to take a little movement from diaphragmatic breathing to doing ventilatory strategies. You can do this with me. We're going to rock back and forth.
With the help of airway clearance, you can get that mucus out of your lungs, and that reduces inflammation, improves symptoms, and improves quality of life. So really, that's our first go-to. When they walk into the door and they have bronchiectasis and they have a productive cough, the first thing we're really talking about is airway clearance to help with their symptoms.
First of all, maintaining a healthy lifestyle is probably first and foremost. Obviously, exercising regularly and meeting the requirements for exercise parameters. Also, a diet and eating healthily, maintaining the appropriate immunizations, and being careful. I mean, if they have lung conditions, don't go on an airplane without a mask. Don't go on subway cars without a mask. Don't be foolish about things. Don't expose yourself unnecessarily. And putting on a mask in this day and age is not something that, people look down upon. And then a very good program of bronchial hygiene.
When using these devices, we really need a qualified, experienced physical or respiratory therapist to show patients how to use these devices, what position is most effective for that patient in terms of expectorating mucus. It's not intuitive. You can't just hand a person a device. I think pulmonary rehab is so important for bronchiectasis.
My one piece of advice to anybody with, whether it be chronic lung disease, kidney disease, heart disease, whatever, as long as you're receiving your optimal treatment, the one thing you've got to do is keep moving.
Whatever is going to be able to be fit into their life is key. We didn't touch on pulmonary rehab, and I do think a formalized exercise program is appropriate for so many patients, and it's only thought about when they're needing oxygen or really can't do everything, and that should be the first thought. We have 2 phenomenal programs, both Pulmonary Wellness and NYU, and I don't know what we would do without them. One of the only therapies that shows me an improvement in survival is standardized pulmonary rehab for many patients with different chronic lung diseases.
When you put a patient who's got pulmonary emphysema on a treadmill, what happens when you start to speed things up a little bit? They begin to cough. So what better way to clean out the lungs?
That aerobic activity with the high tidal volume breathing that people do during exercise really helps with airway clearance.
So what I would say to anybody who's just been diagnosed with a lung disease, get into the basic practice of daily physical activity and airway clearance. I only wish I had somebody tell me that at the beginning. It would have been, I think, extremely helpful, and I would have known that, you're not alone, you're not the only one. That's a nice thing about coming here.
When I first came to Pulmonary Wellness, I said, this is one kooky place. But the vibe was really good because there was just tremendous energy and great joy.
Who do you think is the best looking director of the program?
Do I have to answer that question?
Many patients, they do see clearance, but they don't do properly. And if you don't do properly, you don't get the same results.
Sometimes patients get equipment and they're not taught how to use it properly, and oftentimes they're taught to use it improperly. Empowerment means I know my condition, I know my medications, I know what they do, I know how to use them, and in a way that's going to give them the absolute maximum benefit each and every time.
We've also learned that people get deconditioned very quickly. So you really need a program. You need to surround these people with a program of rehabilitation, nutrition. We've been blessed here that we've had the Pulmonary Wellness Program that has been a great resource for us.
These diseases take a lot of time, and you need to have a physician who is going to be dedicated to giving you that time. Not just giving you antibiotics. There's a lot more to treating these diseases, such as airway clearance, such as nutrition, such as help with anxiety or depression. So you need to have a physician who's going to have the time to take care of you.
When you're in a situation where part of the therapy is pushing yourself Having someone next to you who's really watching what's going on and not just using their eyes, but using technology to observe what's going on, it's a great comfort.
The team here is really special. They give you such personal attention. They monitor your heart rate and your blood pressure constantly, and you just feel safe.
It's hard to have a chronic disease, but I think it's really an exciting time in the management of this disease. It's getting a lot of attention. We're understanding more and more about it. There's more research being done. So while some of the treatments may appear burdensome, I think it's a very optimistic time in the treatment of bronchiectasis.
There's a lot of research going on in sputum and pathological mucus production. This is a whole new area that is going to become very interesting in the next couple of years.
The time that it takes to do airway clearance and to mobilize it is real time. But it's a commitment, I think, that's worth making. So committing to chest therapy, airway clearance, is not taking the path of least resistance.
Whatever disease you have, even if it's a really nasty one, you have to take control of it, and you have to be in charge of it. And bronchiectasis is one of the ones that you really can take hold of. And you can let it defeat you, or you can really work to defeat it.
Hold and think of every little bit as putting money in the bank. Take your inhalers properly, money in the bank. Airway clearance, money in the bank. Good nutrition, money in the bank. And all these things add up to prevention of infection.
Well, I appreciate the opportunity to be part of this, and I think what you're doing is really important, or I wouldn't be here.
The people that you'll see here, these are people who are experienced and people who are committed. These are people who, pardon the expression, they walk the walk, to not just talk about it.